I talked to him about your case. I showed him your case. I said, what do you think? And he actually agreed. He said, something in this area. He also felt like it was reasonable to watch and to kind of monitor because he felt that it was suspicious for a cavernous malformation that might have bled. But really, until something bleeds multiple, I'm going to relay to you what he said to me was that although another bleed can be, devastating or it can be harmful, that typically you don't intervene on something in this part of the brain unless it rebleeds and
Okay.
shows you that it's going to be an issue down the road. Now, are these feelings and are these kind of expert opinions from people here? Yeah. Then we've had now several vascular neurologists weigh in and say, that's they don't really have anything to add. We've had a neuro-oncologist at Dev Force who also agrees that watching this is probably the better part of valor. And now we have opinion of a vascular neurosurgeon who I trust. I think he's a fantastic surgeon and a fantastic doctor who kind of reviewed your case and feels the same way. And of course, you have me, who you met initially when you came into the hospital, and I tried to manage in the safest way possible with a shunt and also a plan to keep an eye on this rather than potentially subject you to a surgery that could leave you with some deficits that we wouldn't want to pursue unless we thought that you were really at high risk of this re-rupturing. Now, that's I don't think we have a comprehensive. There's still a lot unknown in that plan, you know, and watching this I can imagine cause a little bit of stress in terms of dealing with this, dealing with the unknown. So I do think it's reasonable for you to also seek out other opinions from other surgeons who do this, just so that you can hear what they think.
Yeah.
I yeah, and this is partly for your peace of mind, but also partly because maybe you'll meet a surgeon who feels very differently about it. I'm trying to maximize kind of your functional, kind of your brain and how the anatomy is functioning in its present state. But this is my expert opinion. It's not, and that's what it is. It's an opinion to try to manage this difficult
Yeah.
situation for you in the best way possible. But I'm not going to sit here and tell you that I'm the only opinion that matters.
Yeah.
Right. I think
Yeah.
the my question was like maybe I misunderstood. I just thought that the next step was to see the vascular surgeon from your recommendation. And then when that didn't happen, it was causing Jenny a lot of stress. But it turns out that maybe I misunderstood that she wasn't going to be seeing one right away.
Well, we were hoping to get you in to talk to somebody from vascular neurology. Actually, that's what we were
Okay.
hoping for. And it
Okay.
turned out that several of them reviewed the case. And I think what happened was it took a little bit longer than we anticipated because one person would take a look at the case, then pass on it. Then another person would take a look at the case and say, "I also don't have anything to offer," and they kind of went around in a circle, which gave us
Okay.
a bit of a delay getting back to you.
Okay.
Okay.
Because honestly, I was hoping that someone would pick up the case and say, "Look, I would really love to talk to Jenny and give her my opinion about the case," but that just didn't happen. And in a way, I get why this is happening. Is because it's a complex situation where there isn't a really clear answer, and I think some physicians feel like if they can't give you a very clear answer on what to do on the next steps, that they won't have you go through the trouble of seeing them in clinic if they can't give you an answer. For me,
Okay.
I'm your
Where?
I'm trying my best to kind of articulate the uncertainty of the situation, and so in that it's difficult to communicate to you, how many people have been involved in the decision making process and what the answer is, because ultimately there isn't a clear yes or no answer. there isn't a clear path forward other than everyone agreeing that we should probably just watch this for now.
Okay.
And I think, yeah, there was probably a little bit of better communication that we could have had on our part to let you know, like, look, a lot of people have looked at it, but no one has yet taken the opportunity to schedule you in their clinic.
Yeah.
Okay.
Yeah,
I think it was just the waiting in the unknown. It was stressful.
Yeah, and so that's why I appreciate that you reached out to us because please feel free at any point to reach out to our office, and so that we can actually kind of update you on things that you might be thinking about. I actually did not appreciate that you were still waiting and might have some anxiety about this until I heard through Patient Gateway, which is when we just decided to meet with you.
Yeah.
We'll appreciate that.
Yeah, absolutely. So if that ever happens in the future, anytime, don't hesitate to reach out to us because your situation is unique, and we also didn't anticipate that we would have difficulty getting you.
And I know it's confusing because you already have, multiple team members and, who to reach out to about what. But if you're at home worried about something, just shoot us a message. You can always message Dr. Forst too. I know that her team's pretty responsive on Gateway, I think. But if there's ever any confusion, you can always message us too.
Okay.
Yeah. And we would have been happy to clear that up, and I'm sorry that caused unnecessary anxiety for you.
That's okay. Jenny, did you want to talk to them about your swelling and what you need to do?
Oh, yeah.
What's
So my feet have been randomly swelling. The first time it happened, I think it was back in May. And then I also lost hearing in my right ear. My feet were really swollen. I don't know if I sent you guys any pictures. But it's still...
So I don't think we received anything.
Yeah, I don't think we got that.
It's still kind of happening. I don't know if I can even reach up.
Oh, yeah.
Oh, wow.
Yeah, you have some really significant swelling.
Yeah, and I'll send pictures so you can see more clear. But it went away. And then just this past week, it came back.
Is it both feet? I think Emily just asked that.
Yes. So the first time it happened, they were both pretty equally swollen. The second time, and I went to the ER, they did an ultrasound on my legs to make sure I had no clots or anything like that, which I didn't. So they said get compression socks and elevate. That seemed to help. But the second time around, it's mostly been my right foot. And it seems like it's just the top of the foot.
Have you noticed any pain associated with it? Or
yeah, it's been very painful this second time around.
Is the pain just in your foot, or does it go up your leg?
I would say both. Mostly my foot, though.
Is it painful on its own, or is it just painful when you touch it? Like, if you just sit there, is it painful, or is it just painful? Okay. I will say that, number one, this has nothing to do with what's going on up here.
Yeah. And that's what they said at the ER.
Number two, the most important thing the most dangerous thing that can cause that is an acute blockage of the flow. A blood clot, which is what they checked for, which is good. Now, something that in a young person like you that has that issue in both legs, I think that's pretty concerning, Jen. I think that requires a proper workup for all types of things that can be causing that. And one of the people that we usually consult with, do you have a primary care doctor that you actually interact with on a more regular basis?
Oh, yeah, she's been great, especially after all of this brain surgery stuff. She's been very attentive, and I sent her a picture. And
what did she say about that?
So the first time is when I went into a walk-in
Yeah.
And then I went to the ER once I lost the hearing in my ear, and they said that they didn't think the hear loss had anything to do with where my brain mass is. Prescribed steroids, and that seemed to fix it.
The steroids fix the feet?
No, the hearing loss.
Hearing? Okay.
And then I did a ER follow up with her, and we just kind of went over, I don't know, a few things, but I think at that point it was getting better.
Yeah.
So the second time around, I sent her a picture of my feet and just said, hey, just for records purposes, this is going on again with my feet. And she was concerned about it and wanted me to be seen by someone if that meant going to the ER. And I said, I don't want to go back to the ER for this.
Yeah.
But
So is she gonna see you for a visit?
I told her I wanted to wait and see if things got better over the weekend, before I freak out.
How long has this been going on?
I think it's been about a week.
Yeah, and it's not getting better?
It fluctuates.
Okay, and
but
it just fluctuates throughout the day?
The past day or so, it does seem like the swelling is going down, but it's still pretty swollen and painful.
Yeah.
You know what it reminds me of is when I carried my 5 babies.
Yeah.
And when you're late term pregnancy and your feet just swell and they're full of water and they're really puffy, that's when she sent me the pictures. I go, that happened to me on my last pregnancy and it was really bad.
Yeah, I mean,
that happens in pregnancy. It definitely can happen, but in someone who's young and otherwise healthy
and not pregnant,
that's not typical or something that we would expect to see.
Right.
So if it's been going on for a week and now this is the second time it's happened
in a short period,
yeah, I think you should go back to see your primary. I would make an appointment for this week to have her take a look, because she might want to evaluate you for other things or maybe even refer you to someone else to try to get.
I feel like my balance is all off. Like I am just having a hard time, moving around and.
Yeah, I mean, Jenny, I'll be honest. If your primary care doctor has been following you along for this, and she mentioned the possibility of going back to the ED, I don't think that's totally out of the question.
Mm-hmm.
There's something that a lot of different things can cause this type of swelling in your legs, and some of them, and this should never be happening in someone like you.
Yeah,
that's not something that is normal. So, they might have checked in the vessels in your legs, but maybe they should be checking in some of the larger veins that actually take blood from both of your legs back to your heart. It's called the inferior vena cava. And also send off lab values to see if anything's abnormal. Because initially, if you have an issue like this and it kind of gets better, that's one thing. But if it's getting worse and it's painful and it's in both legs, I think you need a diagnosis. Meaning, it would be tough for you. I guess it's a situation because in our situation with your brain, we don't have a clear diagnosis. So I get that. But for something like this, you should actually we went through great lengths and we still couldn't get a diagnosis, and that's okay because we actually attempted brain surgery in order to get that.
Yeah.
But something like this, I think you should really show up to an emergency room, in my opinion, and say, I would really, what is the diagnosis here? Why is this happening? I think that would be important for you. And I know that's a hassle, but I'm just kind of concerned about you, to be completely honest.
Yeah, no, well, and it did help the last time I went back to the ER, and the last time I had been there was for the brain thing, and so they did take me back pretty quickly, And
Yeah.
I got the ultrasound on my legs done before the person went home for the night. So,
But I would do this because your primary care doctor knows you a little bit better. I would do what Emily said and reach out to her and say, look, this is still progressing. In fact, it might be getting worse. Definitely not getting better. Do you think I should go to the emergency room, or do you want to see me in your clinic this next week? And I would maybe just try to reach out to her even before either in the next 24 hours to see
yeah,
what
I'll message her after this. And
yeah, because admittedly, for your brain, it's a different issue. When you came into us, you had symptoms, and then we found the issue. Now, we found it. We don't know exactly what it is, but we found the problem. For your legs, it doesn't sound like they've actually found what the problem is.
yeah, no.
So I think that is even. Yeah, I think getting a diagnosis for that, finding what the problem is, there's clearly something that's not normal.
Yeah.
Okay.
Is there a specific test she should ask for?
There's so many different tests, but basically, make sure that there isn't like some kind of metabolic thing going on.
Like your electrolytes,
yeah, your liver
kidneys,
function, yeah,
like general fluid status. Someone should listen to your heart and lungs, and do a good physical exam.
yeah. There's so many things that could be causing this, and
yeah.
You want to go somewhere where they can do all the tests that you need.
Especially because it happened again. One time you could say, this is a little strange.
Yeah.
It got better on its own. But if it's happening again, you really deserve an answer for why that's going on, and making sure that it's not anything, that needs more attention.
Right.
Right.
All right.
So you got that, Jenny? You need to call your primary care and let her direct you from there.
Yeah.
On what you need to do.
Yep.
Okay.
And then I think your MRI looks like it's August 1st, so we'll keep the follow-up after that. I know MJ had been sending some info over for you to get another opinion, which we think is a really great idea. So you'll get that in the meantime, and then when we meet again in August, we'll kind of regroup. We'll see, what your other opinion said. You're also going to see Dr. Forst, I think, around that same time frame.
Yeah.
And we'll try to make some more decisions from there.
Yeah, and I can keep you guys updated with my first appointment with the second neurosurgeon is July 1st.
Oh, perfect.
Yeah, so Jen, definitely keep us updated with that. Let us know, and we want you to get as much information as possible too. So I'm happy that you're doing that and just gathering more thoughts about this situation, because it's a difficult one.
Yeah. Now, have you guys seen anything like this?
I'll say that in this position, very infrequently, and in my career, no.
Okay.
Yeah, the radiographic appearance does have this kind of features where it looks like a cavernous malformation, which is a tangle of vessels that can kind of bleed, but they're ultimately benign lesions that don't invade or kind of spread to other parts of your body. The thing is, I've seen several CAV-mals. I've seen several cavernous malformations, if this is what that is, and they aren't located in places like this. What makes yours special is that this lesion is located in a very sensitive area. When they're located in other areas of the brain that I can easily remove, that's no problem. And so I don't put a patient at severe risk by going after it and trying to resect it. But this is not in one of those straightforward locations.
No.
And because of that, taking a biopsy of it and giving you a definitive diagnosis, we attempted to do that in the safest way possible. And because of the location, even taking a piece of it isn't really advised, especially if it's not changing. So, that's where the art of trying to advise you on what's the safest, but what's also reasonable. That's where the balance is. There's no right answer, but certainly there are other opinions, which is why we want you to get
Yeah. That sounds good.
All right, you guys. Well, keep us posted. Reach out if you need us in the next month or so. And I hope you can figure something out about the swelling for sure.
Yeah.
I mean, I told her there's some things she can do, like soak in Epsom salts, raise her feet, try to massage her legs.
Yeah.
Is there anything else you can suggest to her?
You know, honestly,
Compression socks.
all those things are helpful, but really what you want to, the right intervention is going to be tailored to what the cause is.
Mhm.
So finding out what's causing it is the most important thing. These other these other remedies that you can do might actually give you some symptomatic relief, but that doesn't take away from the fact that something's going on.
Yeah.
It's not getting to the root of it.
Yeah.
I would do.
She's just in a lot of pain, so I was just trying to help her to release some of that pain until she could get home.
Like Emily said, elevation is probably the one thing that'll help anything.
Or compression socks. Like, you can buy those at CVS or anywhere. They're tough to put on when you're really swollen, but they do help.
Yeah, so
Yeah.
I the first time it happened, I bought, I think it was small, medium socks, and it did help. My feet were better within a few days, and I got a little elevation pillow. But this next time, I couldn't even put my right sock on.
Yeah, no, they look fairly swollen.
And the pain was really bad, and so I googled it, and it said if it's painful, take off the sock.
Yeah.
So I kept it on my left foot because it felt fine on that one, but yeah, like I said, this time around it is a lot more painful on one side. But I'll send you guys pictures of the recent.
Sure. Yeah, keep us posted on how that goes, okay?
Okay.
All right. I saw your dad sign on here a little bit late. Is there anything that we can answer specifically? I wanted to give him a chance if he had any thoughts.
No, I appreciate you asking, but I think I'm good. This has been really helpful, and I appreciate your time.
Absolutely.
No
It's our
problem.
pleasure. Again, reach out to us anytime. We don't want you to be languishing or anxious without an answer from us. So definitely keep us posted and let us and hopefully you have an informative visit with your second opinion as well.
Mm-hmm.
So we'll look forward to catching up with you soon in the next month.
And I appreciate you guys getting back to me about the, setting this call up just to answer the questions, because we weren't sure why the vascular thing was.
Yeah, we're sorry about that, but thank you for bearing with us.
Yeah,
of
course.
We're moving along. Yeah.
All right.
All right. Take care, you guys.
Okay.
Thank you so much.
Of course.
See
Thanks.
you.
Talk to you soon.
Bye.
Okay.
Bye.
Bye.